Today I'm sitting down with an incredible guest who's truly lived the chaos and the beauty of motherhood in full force. From finishing her doctorate while raising a newborn to starting her own business with 3 kids in tow, she's got wisdom, humor, and a hard-earned insight to share. We're diving into some big questions today, like how to handle mom guilt, how to stop feeling like you're never doing enough, and what's actually helpful when breastfeeding feels overwhelming. She'll also be sharing what it really looks like to chase your goals without losing your mind or yourself in the process. There are so many gems in this conversation that I know you're going to want to take with you. Let's get into it. Hey, I'm Dr. Angela Downey, and this is Paging Dr. Mom, the podcast for women who are juggling careers, kids, chaos, and cold cups of coffee. We're talking about the real life behind the resumes, the messy moments, big feelings, and how to stay human when you're doing all the things. If you've ever felt like the only one trying to keep it together, you're not. We're going to laugh, cry, vent, and thrive together. So here we go. Hello to all my busy mamas. I'm Dr. Angela Downey, and I'm so glad that you're hanging out with me on Paging Dr. Mom. This podcast is for all of us who are just trying to keep it all together while juggling kids, careers, and whatever else that life throws our way. We're keeping it real, having some laughs, and talking about the parts of motherhood that we definitely wouldn't put on our resumes. So if you're feeling a little overwhelmed, a little tired, or just need to hear someone say, "I'm with you," then you're in the right place. My guest today is Krista Cassel. Krista is a pediatric nurse practitioner with a doctorate of nursing practice in pediatrics from the University of Kentucky. She's a 3-time breastfeeding mama, a board-certified lactation consultant, and a daily presence in pediatric primary care, where she manages both well and sick visits and supports breastfeeding families during postpartum visits and support groups. Krista is also the founder of Gratitude and Grace Lactation, a virtual private practice created to bring faith-filled, compassionate, and accessible breast care to families, especially in rural and underserved areas, right when they need it the most. As a Christian, wife, and full-time working mother, she knows the beauty and challenge of finding balance in life and motherhood and strives to live each day grounded in gratitude and grace. Hi, Krista. It's so great to have you on Paging Dr. Mom today. How are you?
I'm wonderful. How are you?
I'm doing really well, thanks. I'm really happy to have you on the show. Your story is such a powerful example of what it means to show up for both your family and your calling, even when things are really messy or they're exhausting. And I know that a lot of listeners are going to see themselves in your experience today. You've walked through motherhood, through all the different layers of ambition and guilt and growth. And I'm just really grateful that you're taking time out of your busy schedule to meet with us today.
Thank you so much for having me.
So why don't we start by having you introduce yourself and your journey to the audience?
My name is Krista Cassel. I am a pediatric nurse practitioner and IBCLC lactation consultant. I'm also a 3-time breastfeeding mom, and I came to that journey of becoming a lactation consultant not because I loved breastfeeding, but because it actually came really hard for me. With my 3rd child especially, he was born during COVID where there was no support, and because of some changes that I had had between my pregnancies, we had a hard time latching and struggled with weight gain and breast milk production. Because of all that, had a little bit of postpartum depression and anxiety because I felt like I was failing as a mother, and was kind of brushed off and set aside because I was a 3-time breastfeeding mom, so it should have been really easy for me. And in fact, it was really, really hard. And so when I joined the practice that I'm at now, the pediatrician that I work with asked if there was anything that I was passionate about, and it was making sure that no breastfeeding mom ever felt alone. So I have my doctorate in nursing practice in pediatrics from the University of Kentucky. And then from there, I started to pursue, after working in primary care, my lactation consultant. And now I get to support breastfeeding families in pediatric primary care and also private practice.
Amazing. So you were saying that it was your 3rd child that you were having trouble with. And that's interesting that things went okay for the first 2, but I guess every child is different. Do you teach that child to breastfeed? Like, how is it that the relationship for the 3rd one you think didn't work out as well?
Yeah, so I think that what is so important to know about breastfeeding is that each experience from mom to baby, between children, is completely different because we're all made differently, right? So maybe even if you've done this before, your baby hasn't. And so breastfeeding is actually, we have some instincts, but breastfeeding is a learned skill. Babies give us lots of opportunities to practice, but it doesn't always come out perfect in the beginning. They're built a little bit differently, so maybe it's an anatomy issue. That was the issue that I had with my third, was that baby's anatomy and my anatomy were a little bit different. Also, just my circumstances at the time were totally different. So with my first child, I was in nurse practitioner school and working full time, and I pumped a lot. And so actually looking back, knowing what I know now, I probably struggled a little bit more than I thought that I did. But because I was pumping and bottle feeding, like the latch issue was not as big of a deal. And then my second child, I had the opportunity of just pretty much exclusively nursing her because the clinic that I was working for at the time had a daycare on the campus. So I would see patients, and then when I had a break between patients, I would go down to the daycare and nurse her and then come back and see patients. And so it's a whole cluster of things that makes each experience completely unique. Your circumstances, anatomy, skill level, the delivery can have a lot to do with if there's any sort of trauma during delivery, induction, C-section, postpartum complications, pregnancy complications. Is so unique. And that's why working with somebody is so important, because there is no one size fits all.
I struggled a lot with breastfeeding my child, and I took it as, I was failing as a mother. Baby comes into the world, and within the first 24 hours, I feel like I'm failing. Is that something that a lot of women experience? And how do you deal with that?
Yeah, absolutely. That is something that many moms do frequently experience, because we think that this is just the way that what we were created to do, like it's our sole purpose. And I think that also a lot of the overwhelm that I see in the office is from the amount of information that you can find online. So we were not meant to Google our way through motherhood. Like when you look at history and like breastfeeding cultures, you had moms and sisters and friends and people in the community that were all nursing their babies. Like there are so many women today that have never seen a baby latch. And so I think that it's just our culture and the shift away from breastfeeding when formula kind of came around. And don't get me wrong, like formula is an absolutely fantastic tool, and it's medically necessary for many babies that can't breastfeed for one reason or another. But at the same time, it has also really hindered the breastfeeding relationship and the breastfeeding experience. And so, yes, many moms come in and they're experiencing guilt and feelings of failure, and a lot of the time they just need that reassurance, like that you do have these natural instincts and baby has some natural instincts, and we might just need to do some fine-tuning to work together. But this is not, your ability to feed your baby is not your sole purpose of motherhood.
Yeah. It's funny that you mentioned that women, we don't see babies latching onto women. Not a lot of women were breastfeeding in public more, but they tend to be hidden with a blanket or whatnot. So I think when I envisioned breastfeeding my child, I imagined this baby kind of sucking on this little nipple. And so when the nurse told me to squish my breast and stick it in like a hamburger, I think is what she said, I thought, what are you talking about? Sticking it in like a hamburger? It just didn't make any sense to me. But we really don't get to witness anymore women breastfeeding openly. So I honestly had no idea what I was doing.
Yeah, that can definitely make it hard. So, and I say when I speak about baby feeding in general, I mean, so many women even choose now to provide breast milk through pumping, or sometimes we have adoptive parents or non-birthing parents wanting to nourish their baby. And so there's a lot of different ways that we can encompass that in general. And so what baby feeding or infant feeding looks like for every family is different.
So you support breastfeeding families while also you've breastfed your children. So what do you wish more moms knew about breastfeeding, especially when they're feeling overwhelmed or maybe inadequate?
Yeah, so I think that number one, we need to recognize that each breastfeeding experience is unique, just as I've kind of already alluded to, but also we need to normalize the hard, because I think that especially with what we see on social media, and all of the information out there is the highlight reel, right? It's always the snuggles and the smiles and this abundance of milk, which, is not the norm. And so a lot of what I do in walking alongside families is actually starting prenatally from conception, educating and empowering families to understand what is normal, what is not normal, and then having some tools in your toolkit to be able to pull those out when bumps do come along, because breastfeeding is a journey. It's not a destination. I think it's a lot easier to go into something expecting that it might be a little bit hard and it be easier than what we expect, than to go into something without knowing what to expect, the unknown, right? Or expecting it to be really easy and then it actually be really hard. I find that many more families just give up at that point.
A lot of the times when I see women breastfeeding, they've already been breastfeeding for a couple months and they've got their whole routine down pat and they know what they're doing. So when I see people breastfeeding, they make it look so easy. So when things come hard in the beginning, we're not witnessing that part. We're not witnessing what they went through in those early days. So it's easy for us to think that we're doing something wrong or it's not supposed to be like this, and maybe give up early in those first couple of days.
Yeah, absolutely. I always make it an intentional effort to reach out to my families, even in primary care practice, to reach out to my families around the 7 to 10 day mark, because that's when most parents, I think, initially you have, in the hospital, if we can get you breastfeeding at discharge, our breastfeeding at discharge rates are great. I don't know what they are in Canada, but here in the United States, they're pretty good. But then it's less than 50% are breastfeeding at 6 months. And the most women quit breastfeeding within those first 2 weeks. So in my day job, in my office, I see all of our breastfeeding families, whether they're choosing me as their provider or not, for their newborn visit. So I do the full newborn exam, but then we also tack on a, extended visit time for lactation. And I do a latch evaluation to really kind of make sure that breastfeeding is getting off to a good start. It's right after that honeymoon phase, the 3 to 5 day window, when baby mom's milk is coming in and we're dealing with some engorgement, and then now baby's all of a sudden having a hard time latching and they're cluster feeding, that parents are like, what did I just sign up for? Right? And I would say 95% of my parents come in at the newborn visit too, and they say, my baby has their days and nights mixed up. But I usually try and provide some reassurance, hey, that's great. That's actually nature's way of making sure that your baby is getting plenty of milk, because your milk-making hormone, that prolactin level, is actually highest in those early morning hours. So it's normal that your baby is cluster feeding. And so just normalizing, like I said, the hard moments and letting them know that this is common and expected and that they're doing a great job is so valuable to a parent when they're in those hard times.
Yeah, lots of encouragement would be really helpful, because it is tough. Those first couple of weeks are really hard. So let's go back to those early years of motherhood for just a minute. So you were finishing your doctorate, you were working full-time in the PICU, and you're doing clinical rotations and raising a brand new baby. That's a lot to manage.
Yeah, so that it was a lot to manage. And during that time period, I learned from myself, I learned a lot about resilience. I had been through a lot of really hard things in my youth that I think kind of equipped me for managing some of those harder moments. But I also learned that I could do these hard things, but I was not meant to do them in my own strength. So I really have to credit a lot of my survival in that time period to my faith, and learning to realize what I have control over and what I don't have control over. But then also my spouse, my husband and I have been together for over 20 years. And we've been married in August will be 16 years. And he's a little bit older than me. So when I was in graduate school, he always kind of jokes that he raised me, because we were together all through undergrad and grad school. And he has always just been so supportive of me. And I couldn't have done it without him, because the nights that I was working night shift in the PICU, he was home waking up with the baby in the middle of the night and bottle feeding. And I would check in on them on the baby cam while I was pumping, while he was feeding the baby. So I think the most important thing is just acknowledging and asking for help, because I think that a lot of the time we try and do things in our old in our own strength. And that's when you get to the point of burnout, exhaustion. And so I'm very thankful that I have a supportive partner and that he kind of carried me through that. But then also just being able to learning to surrender what I couldn't control and clinging to my faith during that time.
For sure. Did it shift how you thought about what you're capable of and how much you're able to take on?
Yeah, so I think that it really gave me respect for setting boundaries and learning to say no. A lot of the time I'll say, not right now, so I don't really feel like that guilty of not saying no, but it definitely was a transformative time for me because I was able to see looking back, I can't even explain how I did some of the things that I did. Like I would be in clinicals all day long and then work 12-hour shifts overnight and then go home and sleep for a couple hours. My husband would leave the baby there and then the baby would wake up 2 hours later and I would feed him. And I'm like, how did I make it through that time? But you set a goal. And I think that when you set realistic goals and appropriate boundaries, it can be very transformative. And it also really makes me value now how important rest is. I'm very intentional about setting aside time to, take care of myself because you have to take care of yourself in order to take care of your family, your career well. If you're, they say like if you're burning at both ends, right, then there will be nothing left.
Sure. And, they talk about you need to fill up your cup or else you don't have anything left to pour out of it. And I think it's fantastic that you recognize that so early on because a lot of women struggle with, maybe I can't speak for all women, but I know for myself, I just kept giving and giving and giving and not really doing anything to fill my cup back up and to take care of myself. So it's easy to burn out when you're just constantly giving. I went to medical school. I had 2 kids and I carried a lot of guilt for not being there all the time. And how did you navigate with being so busy, that invisible pressure of wanting to be there for your kids? Do you ever feel like you should have been there more? And how did you deal with that?
So I kind of made it my goal to try, one of the reasons why I really pushed myself so hard was because I made it my goal to get out of school before I felt like my son would really remember. So I took full-time courses and really crammed in the hours because I wanted to be around after his first birthday. And I know that that's not reasonable for everybody, but that was just kind of the approach that I took. And in terms of managing the guilt that I had, it was definitely hard at the time. But one thing that I know, again, surrendering that control, he had a lot of people in his life. My son, he's now 11. He has a bond with his dad, my husband, and my father-in-law that none of my kids have. And so I'm just so thankful for the other people in my village, in my community, that were able to love him so deeply when I couldn't be there. And so even now, now that my kids can ask me to be there for them, I'm very intentional when they're like, Mommy, can I snuggle? Even if I'm, working on something, I'm like, absolutely. I just, at that moment, I pause and I try and be fully present for them. Even if it's only 10 minutes, you can set, again, setting those boundaries. But my child needs me right now and they're going to be my priority.
It's really important to recognize that you're not alone. And you mentioned your community, and you're not alone in raising. And, you were lucky that you had a partner, but you've got parents and neighbors, and there's all sorts of people who can be there for your kids. So not having the pressure all fall on your shoulders. I think it's knowing that there's other people there to help is really important as well.
Absolutely. I am a big believer that, we were not created to do life alone. And when it comes to even for example, the breastfeeding thing, in my office, one of the things that we do is offer a breastfeeding support group to have peers come alongside you and know that, hey, I'm in the thick of it with you, or at the same time, I think it's really sweet when we have some of these moms in the 2-week fit and some that are maybe 6 months now. And so they can say, yeah, I see you. I know that that's really hard, but I've been there too. And this is how we kind of overcame, or things were a little bit easier for us. And then I've also started to create that in a community in the virtual space with my business, Gratitude and Grace Lactation, we have a support community online and a virtual support group to kind of extend from that standpoint.
So you founded a business. So that's what you're referring to, the Lactation and Grace?
Yeah, so it's called Gratitude and Grace Lactation. It is a private practice, completely virtual lactation business where I walk alongside moms in their breastfeeding journey, and I do prenatal education classes. I help host monthly free prenatal classes. I'm also going to have some self-paced courses available coming up soon. I do one-on-one consultations, prenatally, postnatally follow-ups, and then we also have a growing Facebook community where moms can kind of come in for some encouragement, empowerment, education, and from there I'm growing a smaller, more close-knit group for like group coaching and a virtual breastfeeding support group.
It's a lot. Good for you. So you've built this business while you're raising 3 kids, and you work full-time still?
Yes.
In the pediatric environment. So how did you decide that it was time to start doing this on your own and wanting to branch out and do other things, and what's helped you keep going?
So I never actually intended to start a private practice. That was never one of my goals in life. I never had envisioned being an entrepreneur, but I actually had a good friend who is also a pediatric nurse practitioner who was starting her own holistic practice, and we were working together. She was consulting me on a few of her families, and so we decided that we would work together on this, and then a few months into it, it kind of made the most sense for us to be separate entities. And so I didn't really understand I had come to that point, but I started praying about it, and I saw a lot of these moms coming into my office day after day saying, I saw on TikTok, or I saw on Instagram, or, all these people online are having these freezers full of milk, or they have this perfect breastfeeding journey that is just really not realistic. And so I was like, okay, I am going to make it my mission to cut the noise on these social media platforms, to normalize that things are not always easy, to normalize those hard moments, to uplift and encourage moms. And so I'm definitely growing. It's not something that I ever intended to undertake, but it is a faith-based business. And so I am using that kind of as my guidance. And, it's been a really beautiful time of growth for me, and then also for my community. And I think that it's definitely something that's needed.
What advice do you have for moms who feel like they're doing everything they can, but they're still falling short?
Yeah, so that you're not a failure. The number one thing that I want these moms to know is that you're not failing, that you're doing the best with what you have and what you can, and that you're not alone. I think also it's ingrained in us to not ask for help, that we have to be strong and that we can't show our weaknesses. But I think that that's where Gratitude and Grace came from, to be honest with you, is that one of the quotes that I love, it's by Ariana Huffington, and it says that living in a state of gratitude is the gateway to grace. So I think that if first and foremost that we just shift our mindset to being grateful for what we have in this moment, whether it be a healthy baby or a warm home or some lukewarm coffee sitting over here, that if you have that mindset shift, then it frees you up to receive grace and extend grace to others. So we also have to extend grace to ourselves. I think a lot of moms don't do that. We set these expectations really high. And a counselor once told me that disappointment comes from unmet expectations, and those expectations also have to be clearly communicated. So you have to kind of understand what's expected of you. And in this moment, it's expected that you show up for your baby. And if you're feeding your baby, you're doing that. And they just need to feel safe and secure. So you're already doing a great job, and you're not a failure.
Perfect. Just by being there and loving your child and making sure they get the food that they need and the occasional diaper change, that accounts for a lot. I have a gratitude journal. I write in it every day, and I find that it just really helps me focus on those good things in life that are working well. So you're not focusing on the things that aren't working well, making sure that you're appreciating those small moments in life. And gratitude is so important in life. So the mental load that women carry can be pretty heavy. We're constantly thinking about, Johnny needs to go to the dentist again. So these aren't always like just day-to-day things. It's not just making sure that there's milk in the fridge, but October's coming around. Are they going to do something for Halloween? What are we going to do? So you're constantly thinking of all these little things that you need to do. And a lot of these responsibilities tend to fall on moms. So what helps you stay organized without letting these things completely take over your brain?
Yeah, I am a big proponent of writing it down. Like, I just feel like if I don't get it out of my head, it consumes my capacity to be present. And so I have a whole category of notes on my phone and Google Docs, or sometimes I'll just take a piece of paper and jot it down. I'm one of those girls that also really likes a paper planner. So yeah, I've got my Google Calendar, but I like to journal, I like to write. And so I just, with that mental load, even if it's, just a little affirmation to myself, like write it down on a sticky note. In school, when I was in nursing school and grad school, like I am the kind of person to rewrite my notes. That's how I would study. I'm a very tactile person. And so when I take that thought and put it down on paper, then it frees me up in a sense. And so I'm not great at being organized, but I definitely am trying from that standpoint, but I have to write it down.
Absolutely. It's very easy to forget those things. What is one thing that you wish you had known as a new mom that now you try to share with patients or friends or in your support group?
To ask for help. Definitely, because again, like when I struggled in my journey with my third, like I was like, okay, I just have to do this myself. And I think if I had dug deep enough, I probably would have been able to find a virtual lactation consultant or somebody that could have helped me in the world of COVID. But when things get hard, when you don't know what else to do, ask for help. That can look like help from your partner. It can look like help from your mom, your siblings, your friends, your pediatrician, your OBGYN, lactation consultant. But we don't have to do it, nor were we intended to do everything in our own strength. Now, we don't need to go around offering unsolicited help to everybody. That's not the answer. But to being able to acknowledge that we can't do everything in our own strength is so important.
What are some common misconceptions about lactation or postpartum care that you'd like to clear up for listeners?
That it's easy.
Yeah.
Easy breezy.
Fair.
Again, I don't want to scare everybody and, say that breastfeeding is so hard, but it is so much easier to equip yourself with the right knowledge and the right information, not what you find on TikTok, not what you find on, whatever social media platform you're following at the moment, but to go into it knowing that it might be a little bit hard, but hey, I have these places that I can get help, and it's okay to ask for help. And also that no two experiences are alike. Even if you've had an unsuccessful breastfeeding journey in the past, I encourage you to try again. Or sometimes I recognize that we may even have some traumas associated with a very painful or uncomfortable experience that moms are fearful of trying again. But in those moments, those are the ones that are so important to get connected with a lactation consultant as soon as you find out that you're pregnant, because we can kind of troubleshoot and walk with you and prepare you for what can help you be successful the next time. Just because you had an unsuccessful experience for your first journey doesn't mean that this one is going to be the same.
So you would do that even before you have your baby?
That's right. Yeah. So especially if you had, like, say, low milk production with one child, there can be so much that plays into where the low milk production came from. It's not super common that moms, just can't make enough milk. A lot of the time it is inefficient milk removal. It might be due to delivery circumstances. So if you struggled with low milk production, if you have a history of any type of hormonal issues or had previous surgeries on your chest or breast, I definitely encourage, people to reach out to a lactation consultant and get prepared for what is going to help you be successful after baby does come.
It's fantastic. What is one small thing that is saving your life right now? Could be big or small, maybe like a routine or a mindset shift, guilty pleasure, anything.
Yeah, caffeine, for sure. Having 3 kids and working and just surviving life, caffeine, and then also my quiet time in the mornings. I do try and get up, about 30 minutes earlier than I need to start getting ready. And I share my coffee with some quiet time. Sometimes I'll get on the treadmill and try and get a little me time in, but just scheduling that time into my day.
Fun fact about me, I've never had a cup of coffee before.
Wow.
Yeah, it started off, I just didn't think I would like it. And then somebody bet me, one of my classmates in medical school bet me, he didn't drink coffee either. And he said, let's make it through medical school without a cup of coffee. And we did it. So I just never done it. Now it's become a source of pride. I can't bring myself to do it.
Yeah, it's a good example of that you can do hard things, because I don't think that I can make it without my coffee.
Fair enough. How can listeners find you? And are there services that you'd like to share?
Yeah, absolutely. So I am on social media. I'm on most of the platforms, but for Facebook and Instagram, it's Gratitude and Grace Lactation. On Instagram, it's gratitude _ grace and _ lactation. And on Facebook, I also have our community group. So join us in the community. It's Motherhood with Gratitude and Grace. That's open not just to breastfeeding moms, but moms of any season. We have even moms of moms in there, and then their daughters are in there with us. And it's just a really uplifting time. We get on there and share some of those mundane moments and the tiny wins. I also have a website, www.gratitudeandgracelactation.com, where you can sign up to do one-on-one consulting, find out more about my courses and prenatal classes. And yeah, that's where you can find me.
Amazing. Krista, thank you so much for being such an amazing guest today. Your honesty and your experience and your heart really shine through in the interview. And I know that many moms listening are going to feel seen and encouraged because of you. And we all need reminders that we're not alone, and hearing how you manage to navigate motherhood and starting your businesses and sometimes feeling guilty and doing it all with such grace. It's a gift, and I'm really grateful that you took the time to be here with us today.
Thank you so much, Dr. Angela. I've really enjoyed speaking with you.
Thank you. And thanks to all of you who are hanging out with us on Paging Dr. Mom. If you enjoyed today's episode, go ahead and hit follow or subscribe so you don't miss what's coming up next. And if you want to keep the conversation going, you can find me over on Instagram at drangeladowney. I'd love to hear from you. That is it for today's episode of Paging Dr. Mom. If it made you smile, nod along, or feel just a little more seen, then go ahead and hit that follow button and share it with a friend who needs to hear it. Take care for now. You are doing better than you think.